Okay, great. Good evening, everyone. Thank you for joining us for this town hall. I know many of you have had an extremely long day today, so I really do appreciate you taking the time to join us and get to hear some of the great things that are happening at EEC and some of the updates that are occurring. I would like to take this opportunity initially to welcome some of the EEC staff that are here. For those of you that maybe have heard the name but have never seen the face, I will introduce them and just ask them to give a little wave. So I'll start with Sarah Toss, who's the Senior Associate Commissioner for Strategic Implementation. Kelly Pelagian, who is our Family Child Care Supervisor here within the regional office. Loretta Prendeville, who is our Family and Community Engagement. Jennifer Megan, who is one of our Family Child Care licensors in this office. Sherry Feiner, who is also a Family Child Care licensor in this office. Julie Lim, who is our Quality Program Specialist. Laurie Roccaforti, who you can't see due to video issues, is our Background Record Check Supervisor. We also have Julissa Medina, who is one of our Family Child Care licensing staff, and Christine Pond, who is our, I always have to look at her title, Behavioral Health Special Education Specialist. Okay, so thank you for joining us. We got a full agenda for tonight. I'm going to go over a little bit when the slides are brought up to talk a little bit about what the agenda is and what some of the topics are we will be discussing. So we can move forward. So for tonight's town hall, we will be talking about some updates from the professional development centers and some of the things that are occurring there. Some general EEC updates that we would like to share with you, some health and safety review and upcoming changes, some EEC policy updates, some licensing regulation engagement updates, as well as some financing information and feedback. So as you can see, it's a lot of information for an hour time period. We will be touching upon the surface of some of these topic areas, and the deck along with the recording of this will be on our engagement portal after the meeting so that you can access all the information, and there's some additional documents within the appendix that will give further explanation on a lot of the topics as well as some of the forms. So without further ado, I am going to hand this over to Teddy. I'll let you pronounce your own last name, Teddy, who is with the Professional Development Centers out of UMass Boston. So I will let him take over.
Hello and thank you. As I said, my name is Teddy Kokoros. It means rooster in Greek. It's supposed to be the sound a rooster makes, kokoros, but it's a different story. I'm here. I'm the statewide training industry navigation manager on the Strong Start grant working for UMass Boston. And I want to talk to you a little bit about some of the services that we're offering through the grant and kind of get you up to speed of what's going on. So as you may or may not already know, there are 5 regional professional development centers across the state in Southeast Massachusetts, Metro Boston, Northeast, Central, and Western Massachusetts. And they all provide professional development, and the professional learning communities, which I'll talk about in a little bit, are available all across the state. So even if you live in Southeast, if a training is being offered by Metro Boston or Worcester, you're able to take it now. And especially nowadays where everything is online and remote, you can just take things that are across the state. So I want to make sure that's clear to everybody. Overall, our purpose is to provide free, high-quality professional learning at a statewide and local level in the Chinese, English, Portuguese, and Spanish. One of the main ways we do that is through professional learning communities. Our professional learning communities are multi-session events to provide the opportunity for groups of educators and administrators to share experience, test new strategies, join a community, enhance program quality, and improve learning experiences for children. PLCs tap into the expertise of participants. I really want to emphasize that. While the person facilitating the PLC is going to be an expert on the content as well, all of you are experts, and that's especially true now, given the past year with COVID. All of you who've been working in the field, you're the ones who are trying all these innovations, building your knowledge about what works best in the classroom during these challenging times. So the idea of a PLC is now you can all learn from each other as well as the PLC facilitator. So it creates these communities of connection where you can kind of test these new ideas, build these networks, and see what works. And we found in our research that the vast majority of people have positive ratings. I think over 95% of people have positive ratings of their professional PLC learning experiences. Currently, Southeast is offering a number of innovative PLCs. There's things like EEC book clubs, where the whole group will read a book together about early education and care and kind of discuss that topic. There's a program called a PLC called Leading for Change, which is all about leadership development. There's PLCs about building anti-bias, about building after school programs, even summer school programs, and working on those. There's PLCs about finances. So there's so many things being offered right now, both in Southeast and across the state, which we currently have access to. And all of these can be found on our Strong Start website, which you can, I'll put over here in the chat. Give me 1 second. Actually, I'm not sure if I can put that in the chat. I don't think I have access, but Sarah will put it in the chat for me. Thank you. Next slide, please. So in addition to the professional learning communities, we also offer coaching. So coaches are early childhood and IF school time experts who can support programs with reopening, operating during COVID-19, business practices, business administration, staff and professional development needs, staff and well-being and workplace culture, as well as any other issues that might be cropping up in your program or things you might need support on. And you can access these one-on-one supports again through the website directly by contacting the Southeast PDC, or if you live in another region, whatever PDC is closest to you. And in all these cases, again, these coaches work on these one-on-one situations to try to provide support to your individual needs. So while a PLC will be more generic in terms of people having conversations, coaching is, let's say you have a specific challenge in your program, you can talk to this person. Let's say it's like you want to learn how to implement a playbook in a certain section and the best practices for that. They'll sit with you and talk with you about implementing the playbook. So just one example, but there's so many other different things depending on the needs of your program that you might contact a coach for. So I highly recommend that you both check out the Strong Start website, which is going to be in the chat, to find more about the trainings, about coaching opportunities. And even if you're not sure if you need coaching, I just suggest reaching out to your PDC and just asking them, what supports are you offering? And if you have any questions or concerns, because there's always somebody there who's happy to help you and try to support you in your program in any way that you need. Thank you.
Thanks, Teddy. And actually, Teddy, if you want to chat me your information, I can put that into, or the contact information for whoever folks should get in touch with. I can put that in the chat as well.
Will do. Yep.
Thanks. Diana, we got a mute alert here.
I just wanted to expand upon what Teddy was saying as far as the PDCs go. Here in the Southeastern Cape regional office, we do have a really good working relationship with the PDC down here. They have provided some very valuable trainings, very valuable information, assisted providers, as Teddy has said, through a very cumbersome time with the pandemic and the challenges that presents. So I also echo what Teddy said around really taking advantage of those resources. They're there to help. They've created trainings for us that we see a need for. So please take advantage of that. I just wanted to reiterate what Teddy said. Before we get into the general update, I just want to, I should have said this initially, is that based on the content of the training that we have, we may not have time for questions and answers. So if you have a question, please feel free to place it into the chat, and also include your email address so that we can ensure that we respond back to you with the information that you're asking a question about. Okay. So we'll begin with some of the general updates for tonight, and we'll start by talking about some of the testing sites for childcare. As you all know, we have established testing sites throughout the Commonwealth, and those have been operational now for some time. As a result of information we gathered at those testing sites around times of use, dates of use, etc., there have been some amendments to the hours and days that some of these facilities are now open. So we have 3 sites in the state that are now open 6 days a week from 10 in the morning till 6 at night. And that is Monday through Saturday. And those 3 sites are Braintree, Swansea, and a new site that is open in Tewksbury, a new site location in Tewksbury. Obviously, the one that pertains to this region is Swansea. Some Braintree because of the bordering towns that we have with Braintree. So all those sites are now open 10 to 6, Monday through Saturday. So it's a great resource. We have identified that those are some of the times that we felt would be the most beneficial to individuals utilizing the sites. The other thing that I want to stress upon is that the turnaround times are now under 48 hours, oftentimes under 24 hours. Initially when we began, I know that there was some concern about a time delay. Those issues have been long worked out, and the turnaround time now is extremely quickly done. So if you encounter an issue where you're identifying a problem, please reach out and let us know. We can only address the issue if we are aware that it exists. So please feel free to reach out to either your licensor, supervisor, myself, Sarah, and make us aware of that. And we will address the issue. Additionally, as you are aware, and hopefully you've taken advantage of, is that the agency has arranged to provide supplemental PPE supplies to programs. So we have placed, there have been over 10,500 orders placed since February of this year. And 100% of the February and March orders have been delivered. I want to stress that if you want to receive your PPE supplies within a given month, that you do have to order by the 5th of the month. If you do not order by the 5th of the month, there is no guarantee that you will get it that month. So if you're in a situation where it's imperative you receive it that month, that does need to go in by the 5th. All the order limits and contact information is in the lead portals. So additionally, EEC is committed to providing the supplemental PPE throughout the end of June. And we will revisit that at that time to see if the need still persists. Also, as part of the general updates, we want to talk a little bit about the COVID-19 vaccine. People that are eligible that are in the child care worker group include anyone working in or supporting in-person childcare. So that could include family childcare. It does include family childcare educators, assistants, center-based educators, staff, and individual supporting programs like transportation drivers and custodial staff, and also family childcare household members. You would need to utilize the mass pre-registration system to be notified when an appointment is available at a mass vax site. The travel order that was in effect became a travel advisory on March 22nd. So this travel advisory encourages travelers to quarantine for 10 days. All fully vaccinated adults and children under 10 years old are exempt from the advisory, and that programs should communicate their expectations clearly to families. And you have the option of creating your own return to care policy for out-of-state travel. So I just want to reiterate that the travel advisory encourages travelers to quarantine for 10 days, and that you need to communicate your expectation clearly to families, and that you can create your own return to care policy for out-of-state travel. And that way, both you and the families are on the same page with the same expectation of what you are looking for if there is travel that occurs out of state. So some of the upcoming changes, health and safety upcoming changes, there will be updates to the minimum requirements and playbook this month. So the COVID playbook that you're utilizing, there will be updates to that will be occurring within the month. Some of the revised minimum requirements are going to increase the flexibility for programs when proper health and safety protocols are in place. And we're also going to talk about optimizing the availability of outdoor activities during the spring, summer, and early fall based on the change in the weather. Strategies in the programs that you all are using in your homes, that they're using in the center-based programs, they're working. the mitigation of COVID is working based on some of the social distancing, the mask use, the enhanced disinfecting protocol. All those systems that you all have put into place are working and are mitigating the spread of COVID within the childcare settings. So we all know that the vaccinations have started to occur. Some of us have had 1 or 2 shots, and you know, we're starting to see things move forward, but this is really not the time for us to get too relaxed or to abandon the strategies that we've been utilizing throughout this whole year. We still need to maintain social distancing. We still need to practice safety protocols. We still need to do the disinfecting and cleaning and all those things that were identified for you in the playbook and that you have been doing, we need to continue to do. And with that, all of us together can ensure that we mitigate COVID as much as possible within any of the programs or settings that we work in. I just want to go over again a little bit about the reporting the positive cases and exposures to EEC and DPH. So the COVID playbook instructs on how to report positive COVID-19 tests and close contacts. You have the COVID playbook, and there's a flow chart that helps identify that. But just to reiterate, when a child, a household member of a child, educator, or staff member in a program or home, program being synonymous with home, tests positive, you must submit 2 reports: a COVID positive report with the Department of Public Health and an EEC incident injury report. That is irregardless of whether you have subsidized children or not. You need to do those 2 things if you have a positive COVID-19 test result, okay? For a close contact, only an EEC report is required. So that's all that would be required of you if it was a close contact. The positive needs both. The close contact just needs the EEC report. The report is not required if someone in the program/home simply has symptoms without a known exposure. So if you have someone that is exhibiting some symptoms that have been identified as potential COVID symptoms, if there's not been a known exposure, you do not need to report that as an incident report in the league portal. Also, someone testing positive after having contact with a COVID positive person in the same program/home should be recorded as an update to the existing EEC incident injury report, not a new report. As some of you are aware, for those of you individuals who take subsidized children, you would need, in addition to entering those 2 reports if it was a positive, or the 1 if it was a close contact, you need to submit an email to myself identifying that you are requesting a COVID approval closure. For those individuals that may be on this call that are outside of this region, then you would need to respond and send that email to the regional director for the particular area to which the particular region which you affiliate. And just as a reminder, programs can receive subsidy payments for closures due to things like sick staff members' children, need to perform deep cleaning, staffing. You can submit the closure requests for that. This update in this most recent document clarifies that programs now may also be paid for closures relating to the administration of the vaccination and possible short-term side effects from getting the vaccination. In either situation, if the closure is for 3 days or fewer, you do not need EEC regional director approval. And that is spelled out in the revision within the new policy. So if it's 3 days or fewer, you do not need to contact the EEC regional director for that email. I just also want to reiterate, based on the extreme volume that we receive, it is very possible that you may be waiting for one that you have not received. Please feel free to shoot me an email. I will not be offended. There's a very significant volume, and I want to make sure that you all are receiving the COVID approvals that you need in order to receive the payments that you're entitled to. So please feel free to shoot me an email if that is the situation. Try to get them all sent in a timely fashion, but please feel free to notify me if in the event that you are waiting. Just once again, I want to reiterate that this payment is for if you take subsidized children, and it doesn't replace the need to submit the incident reports or the DPH report. Any of this information that I'm talking about on these general updates, just so you know, there is more explanation, as I said earlier, in the appendix of this deck, and that will be posted in the engagement portal with the recording. So in-person instruction and transportation, Department of Elementary and Secondary Education required that all elementary schools provide full-time in-person instruction beginning April 5th. EEC policies have not changed with regards to remote instruction. So programs may still serve school-age children during the school day if remote instruction is allowed by the school district. And the subsidy policy regarding remote and hybrid instruction has not changed. So that's all remained the same. The updated transportation policy that we have is aligned with Department of Elementary and Secondary Education's for both school buses and vans. And what that states is that all adults and children 5 years old and older must wear masks at all times while they are on the transportation vehicle. In doing that, they do not have to maintain the physical distancing. Obviously, as it says on the bottom of the slide, it is best practice to maintain that physical distancing, even when individuals are masked, wherever possible. And in transportation, it's the same thing. If it is possible, the physical distancing is still imperative, even with the mask use. But we do allow the situation as described in our updated policy. Also, we want to reiterate that proper ventilation is also required during transportation within the school bus with the masks and hopefully some physical distancing as much as is allowed. A subsidy rate increase was approved at the EEC March 2021 board meeting, and this increase will be implemented by May 1st and will be retroactive to July 2020. EEC encourages the funds associated with this increase in transportation reimbursement to be utilized for transportation purposes. And EEC has posted the rate increase documents in CCFA, and CCR&Rs will send a notification to center-based providers with more details. So this is for your information, and this is information sharing around the rate increase. So family child cares providers providing care to children with subsidized tuition are now eligible to participate in the Massachusetts Paid Family and Medical Leave, which is usually referred to as PFML program. Eligible providers can apply for PFML through the Department of Family and Medical Leave. If you plan to take PFML, you need to notify your licensor at least 30 days before your first day of your leave. If you need to take it unexpectedly, you would need to notify your licensor as soon as possible. Once again, more information on each policy, this is just touching the surface because of time, are available at the end of the presentation and will also be available on the engagement portal. So for those of you that have been on our website, you're pretty much aware now that we do have a strategic action plan portal. And this is a great resource. It's a one-stop shop for all EEC engagement opportunities. You can respond to surveys, register for live events, find out more about the strategic plan and the initiatives that the department's doing. It is really exciting that all that information is in one location for you all to find it. Just some of the data and the statistics that we've gotten from that so far. There have been 21 live opportunities offered to date where people have been able to engage live. There were 8 surveys that have been done so far that have gathered over 2,000 responses. 33,000 page views at the strategic engagement portal have occurred. There's been 13,000 unique visitors to the portal, and there have been 4,684 registrants across all live events. So that's a real encouraging number for our gathering everything within the engagement portal and involvement by everyone in creating it in one location. You will notice that there is also a QR code on the bottom here that if you scanned with your cell phone, camera, iPad, it will bring you right directly to that location within the EEC website. In February of this year, we launched a past engagement page, and that has the recordings of all the live events that EEC has done, summaries of survey results, and downloadable resources that are shared during these events. So a lot of times when we are doing these trainings, it's a limited amount of time, but all of this information is recorded that someone can go back and look to, as well as a lot of the documents are there for resources for individuals to utilize and reference. So we strongly encourage that you do continue to use the engagement portal and become engaged in information that we distribute and present live. Results from the February and March surveys that individuals took part in will be posted soon. And this location here, once again, the QR code will also have the recording of the event, this event, as well as this presentation. So you'll be able to reference that. If there's someone you know that for some reason or another could not attend, please encourage them to go back and look at this. It's some really good information, and it is something that we want to share and want to get out to the provider community. So what are the next steps for our EEC engagement? So there's going to be a little bit of a pause for the rest of April from some of the surveys and whatnot that we've done in the process of digesting what's already been shared with EEC. EEC will be working to incorporate the feedback into the development of initiatives. And you can access, as I just referenced, the past engagement page to catch up on events. You couldn't attend live, review survey results, and come back ready with more feedback in the next round. I just want to give a shout out here that this is your opportunity to share your voice. The live engagements, the information gathered through these meetings and surveys is looked at very closely. Information is gathered, data is collected, and they are having a major impact on initiatives by the department, on policy development, on a whole host of things that we're engaged in right now. So I really want to encourage you to take full advantage of that, become part of the voice, become part of decision-making, give us the feedback that we need as the individuals that are on the ground level dealing with family child care on a daily basis, sometimes 10 and 12-hour days. So I know it's a long day, but please, please take the time to give us feedback, because only with your voice can we make decisions that work in the interest of children and families. And there'll be new opportunities becoming available through April and May. I'm going to hand it off now to Sarah Toss, who's going to talk a little bit about the regulations.
Thanks, Diana. I am actually going to fast forward, and we're going to go straight to Jocelyn Bown, who I'll have introduce herself real quick, and then we'll come back to the regulations at the end. So Jocelyn, take it away.
Thanks, Sarah. I'm Jocelyn Bown. I'm the Associate Commissioner for Research and Program Innovation. And one of the projects that I've been working on is the design of some of the funding opportunities that are upcoming. So I'm going to take a few minutes and go through a couple of opportunities on the close horizon. So if we go to the next slide. We currently have two different opportunities that we're working on. The first is a state-funded set of grants, one for center-based programs and one for family childcare. The center-based workforce grants are available to center-based programs within the subsidy system and are focused on supporting center-based programs in addressing current staffing issues. To be eligible, a program has to have served at least one subsidized child since July 1st, 2018, and the funds must be used to support educators, either through, you can think about things like hazard pay, signing bonuses to hire new staff, paying out unused PTO, but the goal of the grant is to support programs in addressing the challenges that they're finding retaining and hiring staff. The Family Child Care Facilities Grant will be available to all FCC providers and are designed to address health and safety program investments or quality enhancements. And these funds can be used to reimburse investments that have already been made. So you can cover past costs with these funds, or you can invest in new upgrades to support health and safety protocols. And in terms of timelines, we're currently in the process of getting the grant application ready to open it. We hope to have it open in a couple of weeks. Once that is open, we will deploy funds on a rolling basis through May. And this grant will be wrapped up by the end of the fiscal year. Next slide. The second opportunity is a stabilization grant program that we're using the recent federal funds that are allocated to Massachusetts. One thing that's important to know, we are currently waiting for the legislature to pass a supplemental budget, which will appropriate these funds for EEC to spend. So we don't even though Massachusetts has the money, EEC does not currently have the money. But while we are waiting for that process to work its way through the legislature, we are in the process of developing a formula that will be used to support all programs. We're calling it the Commonwealth Cares for Children, or the C3 formula. And I'm going to dig into the details of our thinking about that in just a second. But we did recently have a live engagement that is recorded and posted on the webpage from the beginning of March. And in terms of timelines, we are currently working on the formula. We hope by mid-spring to have a design to put out for further feedback, although we're collecting field feedback all along the way. And then hopeful that the appropriation will be passed so that we can start dispersing the funds, hopefully before the end of this fiscal year, but certainly through the summer and into the fall. Go to the next slide. So this work is something that we're doing in partnership with a team from Third Sector. And actually the original conceptualization of this work started back when we were working on the strategic plan prior to the pandemic, and thinking about ways in which we could support financially building the backbone for quality, and considering the need for program level investment to provide sustainable and adequate funding for that type of work. With COVID, I think everybody's aware that this has just reinforced the necessity of improving program financial stability. And that the real strong need for approaches that stabilize day-to-day operations of early education and care program. So this work has been focused on identifying and testing ideas around a formula that might accomplish this for the field. Can you go to the next slide? And as part of this process, we are conducting outreach because we do want to be sure that this formula will equitably distribute the federal relief funds. And stakeholder engagement is going to be essential for us in getting this formula right. So we are committed to having a diverse group of stakeholders participate in giving us feedback that we can use to support the design of the formula, and think about answering questions such as what the best way is to structure the funding for the immediate needs of the field, but also thinking about how this approach might evolve into a new support for the field over time. And we want to ensure that the formula does not leave out any group of providers. So, we are intentionally making sure that we're thinking about center-based FCC as well as programs that are serving just out of school time and after school. And we do plan to use a range of opportunities like this one to provide information on the formula and solicit feedback to inform how this funding is structured and delivered. And I just reiterate, if you have thoughts as I talk through the formula, please feel free to provide feedback in the chat, even though we won't have a live Q&A tonight. In May, we do plan to reconvene a larger session to share back some of the current thinking on the formula at that point in time and get further broad-based feedback. So here's where our thinking currently is on this work. And again, just a reminder, because this is a work in progress and we really are trying to gain input as we develop, the things that we're sharing here might change as we get new information from the feedback that we're getting from the field. But to frame this up, we have about 100 million that is available in the first round, or I guess it's really the second round of federal funding if you count the CARES Act, but the first round that came through more recently. We plan to use this to distribute through multiple payments, and the funding amounts for each provider will be determined by a formula. And it's important to note that this payment is meant to operate in addition to current state funding. It's not replacing anything. So the subsidy funding will continue as it has, and that development is continuing separately from the development of the formula and the thinking about how to plan for this type of funding. Next slide. So this is where our thoughts are at the moment for the details of the formula. We want to have a base amount that is designed to cover a relatively standard percentage of the cost of care for each program, and enough to make a difference in a program's stability. And adjustments are then meant to advance EEC's priorities, both ensuring equitable distribution of funds and increasing early educator pay and encouraging the delivery of high quality care. So the two components, the base amount is available to all programs, will be available to all programs that are open, and it will be adjusted to reflect differences in program characteristics that are related to the cost of care. So we'll recognize the differences in the ways different program types function and the different costs that different types of programs face. We're looking to adjust for the different costs in different regions of the state, and also take into account that it's more expensive to serve infants than it is to serve after school children or school age children, for example. And the scaling will always be based on license capacity, particularly for center-based programs where there's such a difference in size and significant differences in costs as a result. And then we also want to look at ways that we might make adjustments to further support programs that are located in under-resourced communities. So there is something called the CDC Social Vulnerability Index that allows you to rate some communities, not just by the poverty level in the communities, but other characteristics that are associated with social vulnerability, such as employment, access to different types of opportunities. And this can be used to think about how we could also scale payments to, further enhance our commitment to investing in more vulnerable areas in the state. We're also interested in thinking about ways that these funds can help programs continue their investment in educators. I think one place that we're particularly interested in feedback on the FCC side is how to think about this particular characteristic and quality in the ways that we might use this funding to support your own investment, as you are the educator. And so it would be in some ways your investment in yourself, or thinking about how to hire an assistant, for example. But thoughts on what we should be considering are something that are very important for us to consider. And as this note says, we do plan to keep talking about this particular dimension of the formula, because it is one that is particularly important for us to get feedback about what's meaningful for the field. So that's the summary of our thinking to date, and we'll absolutely keep sharing information and talking about this as we go.
Thanks, Jocelyn. Really appreciate that. I'm going to scan back through now. There we go. All right. And do just want to reiterate what Jocelyn just said, which is that a lot of what Jocelyn just talked about is still under, in development. This will not be the only time that you hear about it. And it won't be the only time. There will be more to come on this. Nothing is already baked. So I'm going to talk a little bit now, hopefully not too long, because I know it's 7:45 at night and you all have had long days. So I'm going to try to blow through this, but still get to what we need. I'm going to talk a little bit about kind of our regulatory engagements and what we have heard to date. So just to give you a little bit, want to kind of start off just by clarifying that there are two major pieces that we have when it comes to regulations. There's the regulations, which are the enforceable rules that child care programs have to follow, and changing regulations, which we're doing right now, as you all know. I'm sure a lot of you have been in the engagement sessions around giving us feedback around new regulations. Changing regulations is very difficult and takes a long time, but policy and the policies that flow from those regulations are much more malleable and easier to update. So what we want to do is we want to be intentional about the two different levers that we have, and make sure that what's in regulation is truly meant to be in regulation, and using policies to really support what is in the regulation. We really want to think about how policies help us promote accountability, help identify parameters around anomalies, and be responsive to the different needs, and help us clarify expectations across all programs, and help us improve efficiencies for the field and for EEC staff. So as we move ahead, we are going through the process now, as I just said, of revising all of our regulations, and we have this opportunity to really customize regulations for each unique program type that we have here in the Commonwealth. And that is by far the biggest piece of feedback that we have heard through our first sessions, is to differentiate each regulation by program type. So what we're envisioning, as we've heard that piece of feedback, is a format that will have the same general topics across all program types, but that each program type will have specifics that are tailored to that specific setting. So in the example that you are looking at here, you can see this one is regarding a daily schedule. There would be 3 different regulations, one for family childcare, one for center-based programs, and one for out-of-school time programs. And each would have a regulation about daily schedule, but the components of the specifics of each one would be specific and unique to the program setting. And the specifics would obviously depend on the specifics of the program. So are you working with only mixed age groups? Are those mixed age groups, do they have school age children? Do they have infants and toddlers? That means, those differences would obviously lead to different regulations based on the program. So as we're building this vision for these new regulations, we are still looking to infuse quality everywhere we can. So some of this that you're seeing right now might look familiar from the context of the environmental rating scales that some of you may have seen before, as well as some other national standards that we have incorporated as we begin to redesign and rethink about each program type. So now, moving on to educator regulations and differentiating those from licensing regulations. Our licensing regulations are really about the licensee or the program being able to obtain and maintain a program license, whereas an educator regulation is about a person, an individual, and not a program. So educator regulations will largely be about how the individual educator can obtain and maintain their qualifications. Currently, this process involves BRC, pre-service training like the EEC Essentials, CPR, first aid, those kinds of things. And from that perspective, it's the program's responsibility to ensure that the individuals who are hired to operate the program and to work directly with the children meet the stated criteria. But on the educator side, we're thinking more about what those things, what those specific things are that a program should be looking for in the folks that are working in the program. We really want to recognize that there are many different pathways that can lead to high quality teaching and learning. And this is a great opportunity that we're engaged in right now for the state to communicate those expectations around professional competencies as we look to credentialing and what will be applicable to all professionals, regardless of where they work, if it's a center-based program or family childcare, where they are in their career, if it's 1 year in the field or 30 years in the field, and whatever the aspirations are of those folks. So this is maybe a slightly busy slide, but I do think it's actually, I think it's one of the more important ones here because it gives you a glimpse into what we're thinking about designing to support programs as we roll out new regulations. And I do want to say we are not close to rolling out the actual new regulations. We still have a lot of work to do to incorporate feedback, get more feedback. So this is something that we're throwing out there for the long term that we're thinking would be helpful. But obviously, if you have thoughts on it, please put it in the chat and let us know. So on the left-hand side here, you'll see basically a table of contents, which would be the regulations themselves. And you would be able to click on each one and read the legal regulation that the program would be governed by. But on the right-hand side is the more exciting piece, which is a supplemental resource that we'd love to develop. And the way we're thinking about structuring it is that there would be one each for each regulation. And it would have a section that would state clearly the rationale for the regulation itself. So why is this important? Why is this regulation important to have in childcare, in particular in a family childcare or a center-based childcare program? And then related, any policy that was related to the regulation, and additionally, any supplemental checklists or templates that would be related to that as well. So part of where this is coming from is that we did get good feedback on the playbook and how it embedded both the minimum regulations as well as supportive information about how to implement those minimum requirements. I'm sorry. And so that's what got us thinking about this kind of more nested approach to actual regulations and supportive documentation as well. I can't promise that it's going to be as graphic heavy as the playbook is, but I do think it's going to be an incredibly helpful resource to programs. So we are excited about this. And again, just like the financing information that Jocelyn shared, this is not the last time that you are going to hear about all of this. This is just a first pass. And so I encourage you to keep your eye on the strategic engagement portal that Diana mentioned before, and that I hope all of you have visited. And make sure to continue to engage with us so that you hear about these things and that you have the opportunity to weigh in on the pieces that are most important to you and running your program well. So Diana, I'm going to stop sharing and I'm going to turn it back over to you. The chat has been very quiet tonight, and so if you have any questions about anything that came up, please do feel free to put that in the chat now.
Mm-hmm. Okay, thanks, Sarah. So as you can see from tonight's town hall, there are many initiatives that are being worked on within our department, really exciting and innovative changes that we're approaching. And I want to continue to encourage you to interact with our engagement portal. If you have questions, either put them in the chat. If you think of something after, please feel free to reach out to your licensor or the supervisor or myself. And we will get the answer as best we can for you at this time as where things are in the process about what you may be asking. Also, I just wanted to take this opportunity to thank you all for joining us this evening. I know, as I mentioned earlier, that for family childcare, it's an extremely long day, and we do appreciate you taking the time and the interest in finding out the things that are happening within EEC and the updates that we have. I also just want to acknowledge that I know that with the COVID pandemic that we've been dealing with and all the strategies that you've been implementing to minimize transmission of the disease, how much it is appreciated, how I know that it is a time where we've never thought basically that we would ever have to face with a pandemic, but all of you have stepped up to the plate. You've remained open. You've allowed children and families to have a resource to go to so that they continue to work. Children can continue to be in a safe place. So I just wanted to say thank you for that. And thank you for the anticipated continued engagement with children and families and all the great work that you're doing on a daily basis. So with that, I will say good night, sleep tight, and stay well. Thank you.